Good evening. Welcome to this edition of the 411 Talk Zone radio show. My name is Leon Jones. Tonight's topic, bipolar disorder, symptoms and treatments. Bipolar disorder, symptoms and treatments. When we talk about a bipolar disorder, what we mean is a bipolar disorder is basically a serious brain illness. It is called manic depressive illness or manic depression. People with bipolar disorders basically go through unusual mood changes where they are sometimes very happy and up and even more energetic and active than usual. This is called a manic episode. Sometimes people with a bipolar disorder feel very sad and down. They have very low energy and they're much less active. This is called depression or a depressive episode. Bipolar disorder is not the same as the normal ups and downs everyone goes through. The mood swings are more extreme than that, and they are accompanied by changes in sleep, energy level, and the ability to think clearly. Bipolar symptoms are so strong that they could damage relationships and make it hard to go to school or even keep a job. They can be dangerous. Some people with a bipolar disorder try to hurt themselves by attempting suicide. Now, remember this. People with bipolar disorders can get treatment. With help, they can get better and live normal lives. Now, who develops bipolar disorders? Well, anyone can develop a bipolar disorder. It often starts in a person's late teen or early adult years, but children and older adults can have bipolar disorders as well. The illnesses usually last a lifetime. Now, again, when we talk about bipolar disorders, one must ask, why does a person develop a bipolar disorder? Doctors do not know what causes bipolar disorders, but several things may contribute to the illness. Family genes may be one factor because bipolar disorders, sometimes they run in families. However, it is important to know that just because someone in your family has a bipolar disorder, it does not mean that other members of the family will have it as well. Another factor that may lead to a bipolar disorder is that the brain structure or the brain function of the person with the disorder. Also, scientists are finding out more about the bipolar disorder by doing studies on it. This research may help doctors do a better job of treating people. Also, the research may help doctors predict whether a person will get a bipolar disorder. One day, doctors may be able to prevent the illness in some people. Now, here's something crucial. We need to talk about the symptoms of bipolar disorder because this is where you get all the mood episodes. Bipolar or mood episodes include unusual mood changes along with unusual sleep habits, activity levels, thoughts, or behavior. People have manic episodes, depressive episodes, or mixed episodes. A mixed episode has both manic and depressive symptoms. The mood episodes could cause symptoms that last a week or two or sometimes longer. Now, during an episode, the symptoms last every day for most of the day. Mood episodes are intense. The feelings are strong and happen along extreme changes in behavior and energy levels. Now, people who have manic episodes may feel very up or high, feel jumpy or wired, have trouble sleeping, they become more active than usual, talk relatively fast about a lot of different things, be agitated, irritable, or touchy, feel like their thoughts are going very fast, they think they can do a lot of things at once, they do risky things like spend a lot of money or have reckless sex. Now, people having a depressive episode may feel very down or sad, sleep too much or too little, feel like they can't enjoy anything, feel worried and empty. They also have trouble concentrating, forget a lot of things, eat too much or too little, feel tired or slow down, they have trouble sleeping, they think about death or suicide. Now, can someone have bipolar disorder along with other symptoms? Yes, The answer is yes. Sometimes people having strong mood episodes may have psychotic symptoms. Psychosis affects thoughts and emotions as well as a person's ability to what is real and what is not. People with mania and psychotic symptoms may believe that they are rich and famous or have special powers. People with depression and psychotic symptoms may believe that they have committed a crime, they have lost all of their money, or that their lives are ruined in some other way. Sometimes behavior problems go along with mood episodes. A person may drink too much or take drugs. Some people take a lot of risks, like spending too much money or having reckless sex, just as I mentioned before. Now, these problems can damage lives and hurt relationships. Some people with a bipolar disorder have trouble keeping a job or doing well in school. Now, bipolar disorders, are they easy to diagnose? The answer is no. Some people have bipolar disorder for years before the illness is even diagnosed. This is because bipolar symptoms may seem like several different problems. Family and friends may notice the symptoms but not realize that they are a bigger part of the problem. A doctor may think the person has a different illness like schizophrenia or depression. People with bipolar disorders often have other health problems as well. They make it hard for doctors to recognize the bipolar disorder. Now, the examples of other illnesses include substance abuse, anxiety disorders, thyroid disease, heart disease, and obesity. Now, if you've watched my previous videos, and I'm going to say it again, a lot of these symptoms tie into one another. So you're going to hear the information over and over and over again, because mental illnesses come from every direction. The bottom line is we got to learn how to treat them. And that's my next point. How do you treat the bipolar disorder? Well, right now, the answer is there is no cure for bipolar disorder, but treatment can help control symptoms. Most people can get help for mood changes and behavioral problems. Steady, dependent treatment works better than treatment that starts and stops. Treatment options include, of course, numero uno, it's got to be medication. Now, there are several types of medications. There are also certain types of medications that can help. Now, people respond to medications in different ways, so the type of medication depends on the patient. Sometimes a person needs to try different medications to see what's going to work best for them. However, with medications, one must understand that medications can also cause side effects. So patients should always tell their doctors about problems. Also, patients should not stop taking medication without a doctor's help. Stopping medication can suddenly be dangerous, and it can make bipolar symptoms worse. Second option is therapy. Different types of psychotherapy or talk therapy can help people with bipolar disorder. Therapy can help them change their behavior and manage their lives. It can also help patients get along better with friends and family. Sometimes therapy includes family members. Now, of course, there are other treatments. Some people do not get better with medication or therapy. These people might try electroconvulsive therapy, known as ECT. This is sometimes called shock therapy. ECT provides a quick electric current that can sometimes correct problems in the brain. Sometimes people take herbal and natural supplements such as St. John's wort or omega-3 fatty acids. Talk to your doctor before taking any supplement. Scientists aren't sure how these products can affect people with bipolar disorders. Some people may also need sleep medications during treatment. Now, of course, how can one get help? Okay, I've already talked about treatments. Well, if you know you have a bipolar disorder, first thing you need to do as well is talk to your doctor about your treatment, stay on your medication, keep a routine for sleeping and eating, make sure you get enough sleep, learn to recognize your mood swings, ask a friend or relative to help you stick with your treatment, be patient. Patience is a virtue because improvement takes time. Now, how can one help someone with a bipolar disorder? Well, you can help a friend or a relative see a doctor to get the right diagnosis and treatment. You may need to make the appointment and go to the doctor together. Here's some helpful things that one can do. First, you got to be patient, encourage your friend or relative to talk and listen carefully. Be understanding about mood swings. Include your friend or relative in fun activities. Just remind the person that getting better is possible with the right treatment. That's basically all you do. Now, if you run into an emergency and you know there's a crisis, call your doctor. Call 911. Call the National Suicide Prevention Hotline. But don't leave the person alone. Now, of course, when we talk about any mental illnesses, if you have loved ones, well, when a friend or relative has a bipolar disorder, it affects friends and family, and it also affects you as well. So taking care of someone with a bipolar disorder can be very, very stressful. One has to cope with the mood swings and sometimes other problems such as drinking too much. Sometimes stress can strain your relationships with other people. Caregivers must miss work or lose free time. If one is taking care of someone with a bipolar disorder, take care of yourself as well. Find someone you can talk to about your feelings. Talk with a doctor about support groups for caregivers. If one's stress level is down, or if you can keep your stress level down, or if one stress level is down, you will do a better job. That's right. I did a video on stress. Stress is a silent killer. So when you get involved with any type of caretaking, with a patient, with a family, with a friend, keeping your stress down will help you do a better job, and it might help your loved one stick to his or her treatment. And that's the big thing when it comes to any mental illness. You got to be supportive, be patient, and you have to understand the mental illness. So education, like I always say during my outro, is power. Knowledge is power. And none of us are perfect. None of us know everything about mental disorders. I can tell you right now, I'm a civil engineer. I'm not a doctor, but I do read the information because it's pertinent, because I may run into somebody who has one of these illnesses. And if they do, I can recognize it and get them help. The biggest obstacles when it comes to mental illnesses is, does the person recognize they have a mental illness? Once they do, you can get them help. But by all means, you must be patient. Remember this, mental illnesses can last a long time, but with the right treatment, you and your loved ones or anybody with a mental disorder such as bipolar disorder, they will be able to live a normal life. And that's my commentary for this edition of the 411 Talk Zone radio show for this evening, Monday, May 8th, 2017. You can tune into the 411 Talk Zone radio show every Saturday from 6 p.m. to 8 p.m. on Blog Talk Radio. Guest call-in number is 215-383-5785. If you like my videos, please share and subscribe to the 411 Talk Zone radio show right here on YouTube so I can continue to give you quality information for educational purposes from a professional and mature perspective. Now on this channel, I don't engage in debates, controversy, or emotional issues, nor do I participate in drama or unnecessary bickering. Why? Because it's counterproductive. This channel is for educational purposes only. And what I do here is teach. I'm giving you the information so you can understand how to survive in the real world, because the real world is challenging. And what you need is the 401 Talk Zone Radio Show channel right here because the information is realistic and positive. There's no denigration here. What you get is researched information because knowledge is power. And if you have a business, a topic, or a new YouTube channel that you would like for me to discuss on YouTube or Blog Talk Radio, please email me at lej6521@gmail.com. And if you would like to leave a comment, and I love comments, leave your comments in the comment section under the video. But make sure that your comments are pithy, no bloviating, pettifogging, or filibustering if you wish to opine. Now that's it for this video. Till next time, my name is Leon Jones. Remember, please be gentle and respectful to each other and have a wonderful and blessed night. Good night.